Good morning. My name is Nattie Leger. I'm the Director of Nursing Pursuit of Value at Ochsner Health System in New Orleans, Louisiana. Excited to be here today to speak with you about a Pursuit of Value project that we did at our organization on the reduction of surgical site infections utilizing the lean methodology. First, it's important to understand that surgical site infections are a significant issue to both patients and hospitals across the United States. A surgical site infection is an infection that occurs at or near the infection site or the organ in which you had the surgical procedure within the 30 days post-surgery. According to the CDC, surgical site infections are a huge complication and a big issue for us to handle. The probability of morbidity and mortality increases with a surgical site infection, as well as the length of stay can be up to 10 to 14 days of an increased length of stay. And also the cost of care also goes up at least $20,000 per surgical site infection. At Ochsner, we recognize that this was a significant challenge for us within our organization. So we decided to embrace this and take it on as a quality project. We aligned in supply chain with our operating rooms across the system. Ochsner Health System is a nine hospital, not-for-profit health system in Southwest Louisiana. We have over 17,000 employees, and our physicians are both employed and community-based physicians. At Ochsner, we identified that the variation in our surgical practices were contributing to our surgical site infection rate. These practices included the skin prep process, our techniques, application, both drying time, our supplies, our solutions, as well as our surgical attire. This variation contributed to our surgical site infection rate. So once again, as I stated earlier, supply chain took the lead and we facilitated a project with our OR teams across the system. This was an interdisciplinary approach and very much a collaborative effort. We included physicians, nurses, supply chain personnel, our infection control department, as well as our supplier, CareFusion, who provided the majority of our supplies in the OR. I'd like to also state that this project embraces and embodies the triple aim of cost, quality, and outcomes. So through supply chain, we facilitated this project using the lean methodology of DMAIC, define, measure, analyze, implement, and then control. First, I'd like to talk about the define stage. It's extremely important at this point of the process to ensure that you have both executive sponsors in the administrative level as well as the physician surgical team. We then identified who those key administrators and surgeons were, got their buy-in and also their approval. Part of the define stage then is to identify those key stakeholders. It was important to have representation from across the entire system in each of the different areas of physicians, nursing, infection control, and supply chain, and as I said, our supplier, to be key content experts around the table as we moved forward. In addition, during the define stage, it's clear to outline the problem statement, which is the variation in our techniques causing the increase of SSIs, and understand what was in scope for the project and out of scope. There are many contributing factors to SSI, but our scope of the project was those issues in the intra-op procedure, specifically the surgical process of skin prep and what was going on in the intra-op. In addition, we wanted to identify a measurable goal. And yes, ideally our goal would be 0 infection rate, but as everyone always says, how do you eat an elephant? One bite at a time. We decided to outline the goal of a reduction of 25% for our initial challenge, ultimately to be at the 0% for infection control. Next, after the define stage, we understood what the problem was at hand, and we identified the goal and the key stakeholders. Then we moved into the measure and analyze stage. Part of the measurement stage is what we call VOC, voice of the customer. So we went out and interviewed key stakeholders around the system, finding out what was working well, what could we do better. After voice of the customer, then we put boots on the ground and did observations at each of the facilities, observing various surgical procedures across the system. From those observations, we created a gap analysis in our surgical process. In addition to the voice of the customer and the observation, we also collected data which each of the ORs were already measuring. They were measuring the SSI rates of 5 different areas: Class 1 surgical site infections, Class 2, our abdominal hysterectomies, our CRS, and as well as C-section rates. Part of the measure and analyze phase is also the review of the literature. For clinicians, 1, it's important to have data, and is it measurable? And then 2, is it evidence-based? So whatever changes we were going to implement, clearly it had to be an evidence-based best practice. So I'd also like to point out, as part of the supply chain, I'm a nurse by profession, so I grew up in the hospital arena, and seeing this side of a project from supply chain and embracing the collaborative approach was very positive on this project. And also part of supply chain, we all work with vendors. I would like to recognize CareFusion. They were at the table and facilitated and participated in all of the various steps that we've been undertaking for this project. Once we completed the define and measure stage, then it was going into the implementation phase. We did a one-day workout, had the key stakeholders around the table, brought all the information from our measure and analyze stage, and we were determined to, from the literature review and all of our data, create a best practice skin prep chart by body system, including the solutions that would be used for skin prep, the application time, and the dry time. Once we concluded at the end of the day, we were very excited. We had our Ochsner Health System skin prep chart, clearly defining what was best practice and an alternative just in case if the patient was allergic to the best practice solution. Then we had the skin prep chart outlined, the application and dry time technique outlined, as well as the surgical tire that was best practice for the operating arena. We then took from our observations our gap analysis and developed an educational plan specific for each of our campuses on where their gaps were. We brought this back to their local leadership to obtain the buy-in from each of the campuses. And then from that educational plan, we created an implementation plan to launch and roll out the project. At the conclusion of the education and implementation phase, we then moved into the control phase, and that is measuring from our checklist of all the important variables in the skin prep process and also the surgical attire on a monthly basis, measured our compliance and our SSI rates. I'm very excited to say by this a collaborative approach, interdisciplinary, using the lean methodology, at the beginning of our project through the end, which took over 1 year, we recognized improvements in all 5 of our areas that we measured. Once again, Class 1, Class 2, abdominal hysterectomy, CRS, as well as C-section rates. In our Class 1 and Class 2, we received over a 40% reduction. In abdominal hysterectomy, we received a 82% reduction, CRS 67% reduction, and C-section a 59% reduction in SSI rates. Once again, as I stated in the beginning, an average of $20,000 per SSI is the cost impact. So at Ochsner Health System, we had a cost avoidance over that 1-year period of over $200,000. Clearly, you could see how this project embraces the triple aim of cost, quality, and outcomes, but also it embraces and supports the 5 key components that IHI speaks of: quality to patients and family, redesign of care, prevention, cost containment, and system integration. Those 5 key components were recognized by supply chain facilitating this project, redesigning our Ochsner skin prep process, the reduction of SSIs across our system, our cost containment, our cost avoidance of the $20,000 per SSI, and also a system integration, standardizing it across the entire system in the collaborative approach with both physicians, nursing, infection control, supply chain, and our supplier. We created several tools in this project: a skin prep chart, a checklist to measure our key elements, as well as a tracking tool of our SSI rates. If you refer back to the AHRMM handout, you'll be able to see these tools. Hopefully this information was useful to you and that you could take on this information and impact your SSI rates at your hospitals. Thank you and have a great day. Once again, this is Nattie Leger from Ochsner Health System in New Orleans.